Hey students, it's Miss Wicks. Today we're going to be talking about the history of psychological treatment. I'm very excited to get going on this unit because so many students over the years have said that the reason they were interested in or signed up for psychology in the first place was because they love or care about somebody or have had class with somebody or have been around somebody with a psychological disorder, and we want to understand that better. Certainly we'll find that mental illness is much more treatable now than in the past. We've done an immense amount of research. We have better medication. We have more effective therapies. So I think by the end of the unit, you'll find that many of these disorders are very treatable, and you can live a perfectly normal life with the proper treatment protocol. And medical insurance is much more likely to cover treatments and be responsive to that. Especially now, we have discovered that there can be quite a link between someone's mental state and their physical health. So for a medical insurance company, it may actually be better and cheaper for them in the long run to keep the person healthy from the start and to maybe cover some therapy sessions versus the client going for years untreated and having something snowball into being a bigger problem. So for example, we know that stress can be linked with heart disease. It can be linked with cancer. The same thing also, with any kind of psychological trauma, with any kind of, mental anguish, whether it's anxiety issues or depression, there's also a link between that and chronic illness too. So we are seeing as well with the pandemic, one of the upsides here is that many therapists are now also offering virtual visits. So I know that some of my former students, some of my friends through social media have indicated that has been a really nice development, that they can possibly avoid a big drive. If they move away to a new city, if they start college somewhere else, they can still get therapy, even if that therapist is not physically in the town with them. So the availability and the access, and sometimes those virtual sessions are cheaper. So again, one of the bright sides of the pandemic might be the access to treatment, and we're seeing a lot of people thankfully take advantage of that. All right, so wanted to get started here. Psychology is as old as human history, as we know from previous conversations. A little bit earlier in the semester, we looked at the history of psychological research, but today we're going to talk specifically about how disorders were managed or not throughout history. So we're going to see that for much of human history, most psychological disorders were very, very misunderstood. They were infrequently attributed to supernatural causes like demon possession or a hex from a witch. And a lot of people were very fearful of mental illness because they just didn't understand it. They thought it was a manifestation of a person's lack of religious faith, or that person had angered the gods in some way, or any number of those things. So for quite a lot of human history, psychological illness has not really been understood or socially accepted. A lot of times, unfortunately, these people were trying to keep this as secret as possible, but they were pariahs to their community. They were driven out of town. So how are people with mental illness treated in the past? And again, today, mental illness is very, very manageable. We have proper medications today. Today, the goal is to keep people out of the hospital as much as possible. So, we're not going to see people warehoused in asylums for long periods of time today. Um, Even in a case where somebody is having a big, big break, like the person has attempted to take their life, um, in that case, we want to get them treated and stabilized so that the emergency passes. And, it is becoming more uncommon to see somebody in a mental hospital for more than a month. An exception to that might be if the person is dealing with an eating disorder and they need to kind of be retrained on how to eat properly. If the person is like going through psychological treatment along with drug or alcohol rehab, sometimes it takes longer than a month to get a handle on some of those situations. And also, of course, if the person has catatonic schizophrenia symptoms. So if that person's, in a waking coma, they can't talk to people, they have periods where, they're nonverbal, then it would be really hard for that person to take care of themselves. So those are some of the rarer exceptions, but the goal today is to keep the person in their home if possible. And of course, there's emergency situations where, we want to get them immediate help. But, with proper treatment and medication today, most people can have a job, they live at home with their families, and we have people who have serious mental illness who, with management, can still have, really high functioning jobs. We have lawyers with schizophrenia. We have, we have scientists who suffer from this. We have people who are very, very, very functional, and live a functional, happy, productive life with treatments. Okay. So back in the Middle Ages to 1600s, a lot of times communities did not understand mental illness. So people were put into jail. They were sometimes even executed, particularly, I know from my AP Euro class that I teach, especially back in the 1600s during the witchcraft craze, people assumed that somebody with a mental illness, especially if they were having hallucinations or delusions, that they were under the influence of a demon or there was a witch spell. So they thought that burning that person at the stake would free their soul from the plague of the supernatural elements, like it would drive the evil spirits out. So many people actually believed that they were doing the person a favor by executing them, because the fire would actually drive the spirit or drive the curse away from them. So again, this was something that most families would really try to hide as much as possible. And there was a lot of misunderstandings about mental illness. People were afraid of people who had psychological disorders. There was a lot of perception that they were dangerous. And of course, today we know that people with mental illness are more likely to be the victims of a crime than the perpetrators of a crime. So that's one of the stereotypes that we want to kind of debunk as well. As we get into like the scientific revolution, the 17 and 1800s, now we're going to start looking for a scientific explanation for the behaviors that we see. So this is really where doctors are now going to try to use medical treatments to cure mental illness. Bleeding was very, very common. And you see at the bottom of the screen there, the little, it looks like a little switchblade. This was called a phleem, and a doctor would use this to cut the patient's skin. And this harkens back to ancient Greece, where they thought that if you were sick, it was because you had an imbalance in fluids. So if you were sick, if you were dealing with a disorder that you had bad blood we had to get rid of, we needed to make you barf, we needed to give you a blister because the pus was what was making you sick, so we needed to draw it out of your body. So a lot of times, when we look at treatments of people during that scientific revolution era, it's good that they're trying to seek a scientific explanation for disorders. The problem is they came to the wrong conclusions, okay? So again, a lot of bleeding treatments, a lot of vomiting. They would put poultices on people's skin to try to raise a blister and then pop it. They were very, very hands-on with trying to treat the disease, but unfortunately the treatments were ineffective. And we're also going to start seeing, at least in major cities, the emergence of mental asylums. Different parts of history, there were asylums for different illnesses, mental hospitals being the most common, but we have asylums for people who had leprosy. We had asylums for tuberculosis victims. There were asylums for syphilis patients. So the same way you might see like a specialty hospital like the Burn Hospital in Galveston, today they also had specialties back then too. The problem with this, though, is again that many of these early asylums aren't really providing effective treatments for the patients. So this is actually a woodcut detailing the Bedlam Asylum in London. It was actually called Bethlehem Hospital, but it got co-opted and nicknamed into Bedlam, which meant disarray, disorder. But back in the 1700s, people would actually buy tickets to go and tour Bedlam and laugh at the patients. And the patients really weren't cared for. There's stories of people drawing on the walls and, just, again, they're just kind of warehoused in this room doing whatever. And a lot of the Londoners would go to Bedlam and just visit it for a fun time. So you can see the ladies in the back with the fan just kind of there to gawk at the patients, or inmates as they were called, which really does tell us a lot about how they were treated. And of course, the hospital tried to defend the practice by saying, oh, yes, we're using the money that we gained from ticket sales to take care of the patients. But again, a lot of the patients weren't getting adequate care. Excuse me. Also wanted to mention I have pictures of some of the abandoned asylums that we can still see, all around England, all around America. And again, in this period, we're definitely going to see in those two countries a deliberate effort to try to treat mental illness. We're not just going to throw people in jail, we're trying to treat them. But again, some of these asylums aren't really that effective either. They might be warehousing the patients. Um, some of these hospitals are pretty creepy. If you've seen American Horror Story season 2, they have a whole season that takes place in a 1960s era asylum, and some of the treatments that they detail in that season are really hard to watch, but that was actually how they would treat people back then. Like, those are real therapies that they would do on people. This is a picture of the spinning chair that they would use to try to make the patient vomit. Sometimes they would also do water therapy, which sounds lovely, but they would use very cold, icy cold water and basically just blast the person with a hose. And there were patients who had hypothermia afterwards. And it was actually used as a punishment in some of the asylums. So that tells you a lot right there. And we're also going to see that a lot of these asylums use some of the treatments as punishment. So the famous book and movie One Flew Over the Cuckoo's Nest details the experiences of an asylum in the 1960s where they actually would use shock therapy to punish the patients. So if you were caught after hours sneaking out, or you were smoking in an unauthorized area, they would actually punish you by giving you a shock treatment. So with shock treatment in the 1900s, the premise here is almost like if we're electrocuting you, it's almost like rebooting a computer. So shock treatment was very, very popular. You can either give the person a glucose overdose so that they have a seizure, or you would actually, like they're doing here, apply the electrodes to the sides of the person's head. And the theory was that, the person, kind of like we reboot a computer if there's a problem today, that the shock treatment was to help calm the person down. A lot of times people in the days after a shock treatment would be very laid back, very sleepy, very docile. And again, shock therapy, there is some evidence that for a small number of disorders like extreme bipolar disorder that's not medication responsive, shock therapy may have some benefit, but the problem is it was used for every type of disorder back in the day. So there were people who had disorders like schizophrenia, which is not treatable with shock therapy, but if they irritated, any of the hospital staff, they could get shock treatment as a punishment. One of the other problems with shock treatment is that it does cause brain damage. Not very surprising, right? If you have more than 10 or 15 shock therapy sessions, you're going to start seeing some memory problems, shaking of the hands. That person really is going to sustain some brain damage. And really, it's not recommended that the person go over, certainly not over 30 or 40 of these treatments, but there were cases in the 60s where patients had had 500 or 600, and by that point you could definitely tell that their response times were slower and that there was brain damage sustained. Um, and again, today, shock therapy is still used, but in a very small number of cases, and there's a different protocol today. It's definitely a choice, but it's not something that's done against the person's will. Today, with all of the treatments that a person has, the patient has to agree to the treatments. I know recently with some conversations about celebrities acting out, people are asking, "Oh my goodness, why hasn't their wife done anything about this? Why hasn't their family stepped in?" And in a famous case this summer, the person's wife stepped up and said, "Hey, legally, unless he does something to harm himself or somebody else, we can't do anything." Like today, we are not going to compel somebody against their will into treatment unless it's an extreme emergency situation. Now, again, if that person tried to take their life, if they attempted to hurt somebody else, that would be a situation where they could be put under a temporary psych hold. But as far as like, hey, you're having a bipolar disorder, your family is not going to be able, in most cases legally, especially if we're talking about someone who's over 18, if this is a legal adult, then we're not going to be able to compel them to seek treatment involuntary. So again, if the person's under 18, it's a little bit different. But today there's a lot of protections in place because families back in the past, back in the day, did abuse asylums to keep up with rowdy family members. There's stories of kids being put in asylums back in the 50s and 60s because they were expelled from school. They were caught out smoking. They were, doing behaviors, riding motorcycles, things that their parents didn't approve of. And their parents were fully able legally to commit them, even though that person didn't have a psychological disorder. So again, that's a reason for the protective laws in place today. We don't want people abusing asylums to warehouse rowdy relatives that they don't approve of. I also want to talk about medication. Medication today is much, much, much better, but the early generations of many of these medications had an immense amount of side effects. Back in the 50s, when the first generation of medications came out to treat schizophrenia, the medications were overcorrecting dopamine. And we learned in the brain unit, last unit, that dopamine is associated also with motor control. So if you have too much dopamine, yes, you can have hallucinations and delusions. But if you overcorrect it, that person has trouble walking. That person has trouble speaking. And the problem with the early medications that were first introduced, decades ago, is that it was overcorrecting. And unfortunately, some of those medication side effects were permanent. So some of our schizophrenia patients developed a syndrome called targeted dyskinesia, where they had trouble walking, they had trouble speaking, and certainly a lot of those medications have gone back to development since then. Every medication that a person could take has potential side effects. So you, of course, want to always have that conversation with your doctor before you start anything. But medications today are much more effective and without some of the really gnarly side effects we used to see. The last thing I want to mention here is lobotomies. Tomorrow we're going to take, or Tuesday rather, we're going to take a deeper look into lobotomies. So we will see that the lobotomy was developed in the early 1900s as an operation that could treat mental illness. We know from our story of poor Phineas Gage back in the 1800s that when he had his railroad accident, it ended up destroying his frontal lobe. Phineas's rod was detonated and basically went through his eye, exited out the top of his head, And that night, he lost about a teacup full of his frontal lobe. So he had some major personality changes after the accident. There was a doctor in the early 1900s named Egaz Maniz who developed a surgery called the lobotomy. And the original surgery was it actually went on the side of your head. So you would have like an incision in your temple. It was very deliberate. It was very, the idea here is that you are destroying some of the misfunctioning parts of the brain. So when people would have lobotomies, doctors were excited because, again, they are more docile, they're easier to control, especially if the patient was labeled as troublemaking or rebellious. Again, you've sustained brain damage. It's going to change your behavior. So there was a later doctor by the name of Dr. Walter Freeman who decided to create an outpatient procedure. So the premise is the same, but the method is different. This is called the transorbital lobotomy. So he actually developed the surgery using an ice pick from his kitchen. Later, he developed a surgical instrument called a leucotome. But what they would do is actually put it through your orbital bone, and they would actually like tap it into place with a mallet. And then over the next 30 seconds to 1 minute, the doctor begins swinging the leucotome around, and it's basically just swooping through your frontal lobe, just disconnecting all of it. Um, Lobotomies were very popular because they were cheap. And I know that that sounds really terrible to say, but, paying for a relative to stay in a mental hospital was much more costly than a $250 lobotomy. And in many cases, they would give the person a tranquilizer. They were actually awake for the surgery most of the time. And then you could go home the same day. Tomorrow, we'll look at the case of Rosemary Kennedy, who was President Kennedy's sister. She was she had a birth injury, and her father had her lobotomized in her 20s. So we'll actually read more about her life in our assignment tomorrow. But very, very tragic. Walter Freeman himself, who developed the transorbital lobotomy, conducted her surgery. And in the article, it actually goes through what happened during her surgery. But it was so extensive that she spent the rest of her life in a nursing home. She was never, ever able to live independently after that. She needed constant nursing care. And it was very sad because, again, her case is very misunderstood. And for many decades, her siblings didn't know what happened to her. They were told by her father that, Rosemary's off teaching out west. She values her privacy. So it wasn't until after President Kennedy's assassination that the other siblings figured out what happened to Rosemary. And it was just a very tragic story. The boy at the bottom was 12 years old, and his parents signed off on his lobotomy because he was getting into fights at school. And this kid is actually still alive. He's actually created a documentary, and I'll link it later for you guys to check out if you're interested in it. But again, his parents were just like really frustrated with his behavior. He was getting into like some schoolyard scraps, and the parents just decided, hey, this, do this to my kiddo. And he, is still alive. He tells a story in the documentary, and it's very shocking. He's a 12-year-old kid having brain surgery for behaviors. And again, it's not related to a psychological disorder. It was because, the parents felt like he was unmanageable. And we're going to see a lot of lobotomies for different disorders, and again, they were very popular because they were very cheap to do. Couple of things I want to add here. Viewer discretion advised. This is a course where we really, like to make sure students are mature. We do talk about some heavy things in the course, and I feel like this is among the heaviest. There is medical footage that I'm posting here of the lobotomy being performed, and the lady is awake. So again, if you're squeamish, if you're not comfortable watching it, stop here. You're fine. I'm not going to play it in this video. If you guys want to follow the link, you certainly can. But it is historical medical footage of the lobotomy. And it's just very disturbing because the woman is awake, she's blinking, she's coughing, and her life is being changed. And the surgery really wasn't effective. It wasn't, it's upsetting. So I am linking it here. It is in our TEKS that we cover psychological illness and the treatment of it. And I feel like it's important to understand the past and understand history so we're not doomed to repeat it. And certainly, we've gone in a different direction today because we want to get away from some of this dark history of psychology. And honestly, some of this is why people today, in some cases, feel very reluctant to go and get help. If you grew up in an era where shock therapy and lobotomies were really, really common, you might be a grandma today, but that's still in the back of your mind. So, some of the history of psychology, unfortunately, has, you know, put people off of getting treatment. But again, it's in the past. Today, the medication and therapy route is how we approach things today. So we've gotten away from all of this, and today, the client, and notice I'm not using the word patient, I'm using the word client. Today, the client is going to guide the therapy. They're going to guide the treatments. We're not going to put people in an involuntary situation where they don't have any autonomy, where they don't have a voice. Patient consent is very, very important. So again, it's because of the dark past of the history of psychology that we take patient consent very, very seriously today. And again, with therapy and with any kind of treatments, it only works if the person wants to be in treatment. So if we commit somebody against their will and they don't want to be in treatments, they're not going to be open to the therapy. They're not going to get the most from it. So again, we've learned a lot from the past. Today, things are much more humane. And again, we focus on informed consent. We want the patient to be comfortable with everything that, with every part of their treatment plan. All right, guys, have a wonderful day. Again, history of psychological treatment. You guys are doing a great job in the course. Right now, we've got about 2 weeks left this 9 weeks. So definitely make sure you're getting your stuff turned in, your Celebrity Brain Project. I am also going to be making a mini video here very soon about our movie critiques, which are a bonus opportunity. But there's a lot of movies, TV shows, books, plays that deal with psychological disorders and treatment of those disorders. And all of those are fair game for this movie critique. So I'll share more about that very soon. You guys have a great day. Thank you.